Are you fed up with lectures using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, this channel will provide a simple way of teaching emergency medicine in layman's terms.
Hi everyone.
Welcome back to my channel. Here on Emergency Medicine on Demand, I go through various patient cases in a very simplified manner. I do one case per episode where I discuss the patient's condition, signs and symptoms, and course of treatment in layman's terms. Yes, you heard that right. This is not the type of channel where you have to pause the video to look up a word. I am not trying to look smart here. I am teaching you in the manner that I wish I was taught in. So, if you hear a big word, you can be confident I will be going over what it means. One last thing before we get started on today's case. I always share a motivational quote at the end of each video. Life can be tough sometimes, so I hope this simple gesture can change your outlook. And now, without further ado, pay attention. Today's case is on CVA, which stands for cerebrovascular accident and is a fancy word for stroke. What is a stroke? A stroke happens when blood flow to the brain is cut off, which would then damage brain cells almost instantly. Now that we understand the patient's condition, let's go over the patient's symptoms. Before we do that, I want to note that depending on which region of the brain the stroke affected, the symptoms can vary. Some of the general signs you would see in a patient having a stroke include a droopy face, weakness in the arms or legs, difficulty speaking, vision changes, loss of balance, and memory loss. The signs and symptoms can be easily remembered by the acronym FAST. F stands for face to note if it is droopy. A stands for arms to note if there is weakness in the arms. Can they lift them both up? S stands for speech to note if their words are slurred and incoherent. Finally, T is time, as you should now be calling for help if you spotted these symptoms. For patients who experience strokes, they may experience long-term issues of performing tasks that used to be normal for them, such as difficulty swallowing, communication problems, and difficulty walking. Strokes can either be ischemic or hemorrhagic. Ischemic means it is caused by a bleed, and the word ischemic itself is referring to an inadequate blood supply. Hence, not enough oxygen is reaching the brain. Hemorrhagic, on the other hand, is referring to a stroke from a bleed. Majority of strokes, and by majority, I mean roughly 80%, are a result of ischemia, aka blockage. So what causes this blockage? This blockage is caused by the accumulation of fatty material. You can imagine these materials mesh together and forming a barrier. Now let's discuss bleeding strokes. These take place when a blood vessel bursts. This is typically sudden. If there is blood in the brain, this can lead to swelling, which is life-threatening and requires surgical intervention. Since surgery is beyond the scope of this video, we will leave it at that. If a patient experienced stroke symptoms that lasted for any amount of time that is less than 24 hours, this is called a TIA. TIA stands for transient ischemic attack, which is a fancy word of saying mini stroke. Funny enough, the symptoms usually only last for a couple minutes. Now, it is crucial to seek medical attention regardless of a full stroke or a mini one, as both cases require medications. Now, how is this treated? Well, there are two instances we will discuss. If you are a bystander and you watch this happening, we will go over what you need to do at the scene. Then, we will also cover how this is treated at a hospital. For the bystander scenario, you would do the following. Let's go over fast again and answer the following questions to yourself. Are they only smiling on one side of their face? Are they only able to raise one arm? Are they barely speaking clearly and/or coherently? If the answer to any of those is yes, call 911 and inform them you are suspecting a stroke. Until the ambulance arrives, offer support and help the patient as much as you can. Make sure they are still breathing and responsive. Keep an eye on their pulse if you can and be ready to perform CPR if necessary. For the hospital scenario, you would do the following. You would confirm the stroke diagnosis by doing an CT scan of the head. CT scan stands for computed tomography. It uses X-rays and will produce detailed images of the brain. It is important to mention that CT scans expose patients to more radiation than traditional X-rays. To clarify why radiation is very feared, it is because large amounts of radiation can predispose you to cancer. Other ways of diagnosing a stroke include, but are not limited to, the following. An MRI, which stands for magnetic resonance imaging, and is basically a scan that will show you clear images of the brain. Cerebral angiography, on the other hand, uses X-rays to show blood vessels so doctors can assess for blockages or abnormal areas. Cerebral means in reference to the brain, while angio means vessel, and as for graphy, think of a graph and/or an image. We also have one more diagnostic tool to go over, which is called an electroencephalography. Just from its name, electro, it is used to monitor electrical activity in the brain. The encephalo part means in reference to the brain, and as for graphy, you can think of graphs and/or images. After diagnosis is confirmed at the hospital, here is the treatment plan for an ischemic stroke. First thing to give is a TPA, which will break up the clot, aka the blockage. By doing so, this will allow oxygen to flow back into the brain. A TPA is a clot-busting drug, but it has a major drawback. The drawback that makes it limiting is that it has to be given within 4.5 hours of stroke symptoms. If the time limit is missed, the TPA would not be given. They will instead put a catheter to remove the clot that is blocking the artery. To clarify for everyone, think of a catheter as a long, thin straw, which they would insert into the patient's body through the thigh area, all the way up to the brain where the blockage occurred. Now let's go over what is TPA. It stands for tissue plasminogen activator. Its weird name comes from that fact that it is a protein that converts the enzyme plasminogen to plasmin, the active form. This enzyme plasmin is responsible for the clot-busting effects. Some drug examples of TPA include alteplase and tenecteplase. Let's go over alteplase since it is the most commonly used. It falls under the drug class of thrombolytics, which in simpler words mean clot-busting. Imagine a needle stabbing a bubble gum. The needle is the drug and the bubble gum is the clot. So, alteplase is given intravenously, which means through the vein. It busts the clot, specifically by dissolving it, which as a result would return the blood supply and restore adequate oxygen to the brain. How about a hemorrhagic stroke then? How is that treated? Well, as I mentioned above, we will not be going over this in too much detail. But basically, we would need emergency surgery to repair the damaged arteries or at least decrease the pressure of the blood on the brain. But remember that this type of stroke is pretty rare, so this is all we need to know, and now we are all wrapped up for today's case. My God, I can talk about the human body and its wonders all day, but without further ado, let's move on to the last and best part of the video that I know you have all been waiting for as much as me. As promised, here is today's quote. Success isn't always about greatness. It's about consistency. Consistent hard work leads to success. Greatness will come. By Dwayne Johnson.